Ladies and gentlemen, good afternoon. This is Bernard Harris with the Pikes Peak Strategic Group and my partner Ed Harrison. We want to talk to you about high deductibles, high medical care deductibles.
Oh, yes.
This is a topic that remains in the top five issues confronting our great nation. A business partner of ours has a premium of between $1,100 and $1,200 a month. He and his wife individually have deductibles of $7,800 each. That's a lot of money, folks. But there is an option out there for you to use to help yourself. I consider that to be an investment, not an expenditure. When you consider the fact for $39.95 a month, you can get a proactive discount healthcare plan that covers your entire household. And when you incur these large deductibles and insurance bills, part of that plan is to have the ability to maybe reduce those debts down to something that fits into your budget. At the same time, that plan includes dental, vision, prescription, chiropractic services. It also gives you total access to the telemedicine program, which is a single best new program in the healthcare world. I call it Star Trek medicine. Ed, what do you think about that plan?
Well, I tell you, you're talking about these high deductibles, and I'm quite acquainted with the associate you're speaking with, but I think you guys know from time to time I'm down in the Arizona area during the winter time, and I've got some friends down there that live in my complex. They've got $10,000 deductibles, and you're hearing across the country where people are paying $30,000, $40,000 a year just for medical insurance, and that doesn't cover dental now. We haven't even got to that yet, but we're talking about these high deductibles. And Bernard mentioned the fact that that the Ameriplan Deluxe program, which we have here, can help people with these high medical bills, and it's called the Hospital Advocacy Bill. And that's a program whereby if you, say for instance, you know you're going in for a procedure, you can you can have a membership through our $39.95 membership, where you could call the CARES groups, which is an affiliate of Ameriplan, and they will try to find the most economical hospital in your area, whereby they can talk to doctors and so forth and see if they can get you a reduction on these medical bills. Or if you have old medical bills, and we know bankruptcy these days are comprised primarily of medical bills. So Ameriplan is a positive alternative for the American people out here. Hopefully sometime in the future, our government and others will find a way to do something in the insurance companies with insurance. But in the meantime, we out here as working folks and trying to make it in today's world, and healthcare is at the forefront, Bernard. And I'm just very pleased to be involved with Ameriplan and be able to share this with our listeners. And I just can't stress enough, if you've got some high medical bills, or if you are experiencing an event whereby you need to talk with a doctor after hours, that is also part of our program, the telemedicine program, where you could call a doctor and a licensed physician in your state and get advice free of charge. If there's a prescription that needs to be written or diagnosis, there's a $25 fee, and they will send that prescription to the closest Walmart or Walgreens or CVS near your home. But the high deductibles, ladies and gentlemen, they're not going away. This is October 2018. The prices are already set with the ACA and other entities, Obamacare, as many people call it, for 2019. So you need to start shopping around now. Open enrollment is open for Medicare, as well as the Affordable Care Act, also known as Obamacare. Also with the federal program for the TRICARE dental, which is going away, not really going away, but they got some new programs, and that's going to be changing. So we encourage you to take a good look at the Ameriplan Corporation and the Pikes Peak Strategic Group. I think we can educate you on what's best for you and your family. And it's about you and your family, not about us. We're strictly here to provide education,
go.
Bernard, and I'm just happy to be affiliated with the AmeriPlan and be able to share this information. You have any final thoughts, Bernard?
Folks, think outside the box, especially for our military folks. That's part of our DNA and part of our training. Get out of your comfort zone, save yourself some money, and get better total care for your family.
Yes.
Thanks so much.